Good evening, and welcome to tonight's virtual information session sponsored by Davidson-Davie Community College. Please be reminded that tonight's information session is being broadcast live via Zoom and Facebook, and is being recorded for future review of the broadcast. Tonight's information session will highlight Davidson-Davie Community College Dental Assisting Curriculum. Now, with the Dental Assisting Program, and many of the other health science programs, there are additional steps to actually being admitted into the actual program. This is due to the program's large number of applicants, which makes it a very competitive process. To explain more, we're thrilled to have Ms. Kaylin Asip to explain that process with being admitted into Davidson-Davie Community College, as well as you being accepted into the dental assisting program. Then afterwards, we're thrilled to have Ms. Meredith Parker, who's going to tell us, she is the program director for the dental assisting program, and she will give us an overview of the program. And by the way, I need to say that Ms. Kaylin Asip is our director of recruitment and admission. We ask that you post all your questions in the chat box, and at the conclusion of Ms. Parker's presentation, we'll be more than happy to answer those questions for you. So with no further ado, I will turn it over to Ms. Kaylin Asip, who will explain the admissions process.
Thank you, William, and welcome everyone to tonight's session. Like William said, if you're joining Facebook Live, please feel free to chat those and post those comments, and we will be sure to follow up with those as well. But however you're joining, we're glad that you're here. I am excited to share information about our dental assisting program, specifically the admissions process for dental assisting. As William highlighted so well, we do have a separate application process that students must follow in order to be considered for our dental assisting program at Davidson-Davie Community College. And I'm going to show some of those highlights and information about how you can be successful through that process. So I'm going to get us started. And if you are following along, I would encourage you to follow along in the dental assisting enrollment packet. So you can, I'm going to review the packet details and answer any questions about the application and selection process prior to turning it over to Ms. Meredith Parker. But the dental assisting enrollment packet for fall 2022 is live on our website. So if you go to the dental assisting program page, you will not only see the enrollment packet for fall 2022, but also the job shadowing form. So I'll talk about both of those pieces a little bit more in length during the presentation. This slide shows a snapshot of the 3 phases that are a part of the enrollment process and consideration for our dental assisting program. So phase 1 really entails the general admission process. And we'll go a little bit further into detail about the specifics of phase 1 moving forward. Phase 2 talks a little bit more about the specific needs in order to be considered for the dental specific program. So the shadowing, as well as some of the continuing education courses that can help boost your review and give you some additional points. So we'll cover that a little further shortly as well. And then phase 3, which is the final phase, is to complete the admission review. So to complete your dental assisting review. So to go further and dive a little deeper into these steps. So phase 1, again, is that kind of broader general admission. So you would need to complete your Davidson-Davie readmission or admission process to the college. If you are a current Davidson-Davie Community College student, you would want to make sure that your application and your program is active in our system and that we have an active RCN, so residency determination status for you in our system. If you're an active student, we should have all of that updated, so you should be good to go. Now, if you're a new student in the process, you would need to submit your residency determination status and your RCN with your application, be admitted as a general student, which most students are admitted to the college under general admission, and then complete the next steps, which includes new student orientation. New student orientation, as noted here, will be closed beginning on March 4th at 5 p.m. and won't reopen until March 18th. That still gives you a little bit of time to complete the new student orientation prior to the application deadline of April 1st for this program, but just wanted to make sure that you all are mindful of those dates, because that does kind of lead up to that application deadline, and you don't want to miss that new student orientation requirement piece. The second piece is to activate your Davidson-Davie Storm Track. Again, if you're a current student, you should have access to your email and your Storm Track account. It's really important that you activate these if you're a new student, because this is how we're going to communicate all of your information moving forward, whether it is financial aid information, whether it's your dental assisting admission acceptance email. All of that's going to be sent through your Davidson-Davie email. So it's really important that you activate your email and have access to your Storm Track account so you can see those updates, you can see where to register for classes and all of those good things. The third step is to provide evidence of achieving a high school credential. So high school credential could be a diploma, it could be by way of your final high school transcript, but we do need proof that you have completed a high school as part of this program. So submitting one of those documents will enable us to see that you've completed and fulfilled that requirement. An optional step, if you have taken college level credit anywhere else outside of Davidson-Davie, we would request that you submit those official transcripts. It's not required. However, we do accept several credits taken at other colleges, especially in the North Carolina Community College system. We have an agreement, so we do accept all those credits from North Carolina Community College system institutions. So I would highly recommend, if you have taken any college credit elsewhere, to send those official transcripts to us so that we can evaluate them and determine how we can give you credit for those courses. And as far as the review goes, credit for those courses and specific grades also contribute to the points that you can achieve for some of those courses. We also are going to ensure that you have achieved college math and English readiness. And there are a number of ways that you can fulfill this. So many of you probably don't even know that you fulfilled it, but you have fulfilled it. If you've taken English 111, that fulfills that English requirement. If you have a certain GPA in high school, your unweighted GPA can determine your English college readiness, same with your math college readiness. And so this is a point that we look at during our review process. So there are a couple of different things that you can see here, acceptable SAT or ACT scores. So if you have any questions about, do I meet English or mathematics college readiness, please feel free to reach out to us and we can look at your record and determine that for you. But this is a part of our review process as well. And then we'll move right along to phase two. Phase two, part of that includes that job shadowing that I mentioned earlier. So this is a component of the application process. And one of what I feel, and I don't know if Meredith feels, this is one of the most valuable portions of the application process, because you get to see hands-on what a dental office, how a dental office functions, and what a dental assisting or dental assistant would do on a day-to-day. And so I think that this aspect and this component is so critical. And it's a great way for you to kind of get your foot in the door and to see what a day in the life would look like for you moving forward. And so there is a 10-hour job shadowing experience that we want students to take advantage of. There is a job shadowing form that is on our website under the dental assisting webpage, where you can access that, print that off, and make sure that you're giving that to the dental office that you're shadowing at. If you're shadowing at multiple dental clinics or dental offices, you'll want to print off multiple copies and distribute those to those dental clinics. And you just want to make sure that you're fulfilling 10 hours. So it can be at multiple sites, it can be at one clinic, but just making sure that you fulfill those 10 hours and then make sure that those forms get submitted back to us with the signatures and them completed. Just a note, during COVID, we know that times are a little bit different and shadowing opportunities might not be as abundant. And so if you are interested in getting a shadowing experience, but you're having difficulty accessing that, feel free to reach out to Meredith Parker, who again is our program director. We have some opportunities on campus that might work for you to fulfill that requirement as well. But She would need some advance notice, so don't wait until the end of this month. So don't wait until March 29th and say, hey, I haven't gotten my job shadowing done. I need to get it done by April 1st. She's wonderful, but I don't know if she's a miracle worker. Don't know just yet. So just make sure that you are reaching out to her well in advance if you're having difficulty, but you can contact any dental office if you have a dentist that you see regularly and you feel comfortable and want to work with that dental office. You can contact any dental office and again, reach out to us if you're having difficulty with that. Another component of phase 2 is life experience. So we do, when we are completing your review process, we look at not only academic history, but also the life experience component, because we want to look at you as a whole student and not just one tidbit of who you are and what you can contribute. And so life experience, there are a number of points that can be awarded based on different medical certifications and licenses that you hold. So make sure that you are referring to the packet. There are specific ones that we look for. If you do hold any of those, you're able to get some points for those life experiences. So make sure that you're looking at that. We do require students to submit evidence of completing the basic life support CPR certification, which is only offered, which is the healthcare provider, which is only offered through the American Heart Association. So that is a very specific requirement, the healthcare provider's version, not just the basic CPR. So when you're looking to register for that, and I'm sure Meredith Parker will talk a little bit more about that in a bit, but make sure that you're looking for that specific one to fulfill that requirement. And then submitting evidence of any successful completion of the following continuing education courses. These are also all listed in the packet. The packet is live on our website, and these links are actually linked within the packet. So if you go to the packet on the website, you can actually click and see these. These are free to complete. And so you'll have access to completing these, and we would just need to see the certificate of completion or verification that these are completed in order to award points. And again, these are optional. However, you'll see in the packet and with the rubric, you can get 2 points for every one of these that you have successfully completed. And that can really contribute to your overall score, as well as what you'll need to know in order to be successful in the dental assisting. So of course, it's going to help with your entry, but it's also going to help you in the long run with your career. And then phase 3 is the review process. So once phase 1 and phase 2 are completed, so we've received all of the documentation. We really prefer to receive that in one email so it's concise, so that we're not having to look at multiple emails to determine that these items are fulfilled. So do one comprehensive email with multiple attachments. Email pwsc@davidson-davie.edu and ensure that we have received all of those items. We will confirm whether or not they're all complete and received, and then you can request a review. And we can do reviews in person, so you can come into the Enrollment Center on the Davidson campus in Mendenhall building, and we accept walk-ins. Or if you wanted to do a virtual one, you can just email us and say that you're ready for a review. And our virtual review is essentially you emailing us reviewing your application, and then us corresponding via email to let you know what your overall score was and to have that conversation. We can also discuss reviews over the phone as well. So feel free to reach out to us at any point if you have questions, or when it comes time for the review, whatever way is your preferred way, we want to make sure that we're accommodating that. And just make sure that you're aware that applicants are responsible for making sure that all items are received to the admissions office by April 1st at 5 p.m. So it is your responsibility as an applicant to ensure that all those documents have been received. I know that some things are outside of our control if you're requesting transcripts from other colleges to be submitted, but you can contact us every single day if you need to see if we've gotten it yet, and we will make sure to communicate with you if once that's received. So be in touch, and don't be hesitant to reach out if you're unsure if we have everything. A little bit about the selection process. So students that do meet the criteria and have submitted everything that's required to be considered for the application will be ranked in order of highest points after April 1, 2022 at 5 p.m. So applicants with the highest overall points will be offered conditional acceptance into the program. And then you can see here there are ties. So if we do have ties, which could be, it depends on the application cycle and year and applicants that we have coming through. But if we do have ties, we do have a tie-breaking system. The first tie would be through the academic history, whoever has the highest academic history. The second tiebreaker would be whoever has higher points earned on the life experience ranking section. And then the third would be the date that the admission, that the applicant submitted the dental assisting shadowing form to the admission office. And so we do anticipate being able to submit the notifications to students no later than April 15th. So April 15th will be the date that all students will receive their notification. If not before, we try and get those out as soon as possible, as soon as we can. And then those students that are offered conditional acceptance into the program have 10 business days to submit an intent to enroll form. That intent to enroll form would be embedded in the email if you are accepted into the dental assisting program. Alternates, so no student is rejected from the dental assisting application process unless you just don't meet minimum criteria. But all students that met minimum criteria are then placed on an alternate list in ranked order. And alternates will be contacted if any student declines their seat and if there's any movement in the acceptance pool. And it's important to note that decisions do not carry over year. So if you are on the alternates list for fall 2022 and you want to be considered for fall 2023, you would have to reapply to the dental assisting program. So, and same with if you were admitted and you gave up your seat, then you would still need to apply again if you wanted to be considered. And then a little bit about conditional acceptance, and Meredith might need to jump in here a little bit, but the full acceptance into the dental assisting program is not, it does not take place until you've fulfilled all of these requirements here. So there might be some required meetings or events scheduled that you would need to attend, purchasing of your uniforms, and there is a uniform fee of about $350. Enrolling in the program classes prior to the first day of class, and setting up your Complio and My Clinical Exchange accounts associated with the Davidson-Davie dental assisting program, and complete clinical clearance before July 1. And I know that date is really important because it takes time to go through clinical clearance. That is not just something that Davidson-Davie does. It includes multitude of things. And so it does take some time. So we need to have that fulfilled by July 1 so that the time is there prior to the start of classes for all students to be able to go through that clinical clearance. And then Meredith, would you mind hopping in on this section a little bit more about the conditionally accepted students?
Sure, thanks, Kaylin. Definitely. So talking about, just kind of carrying on from what Kaylin said, is once you receive, conditional acceptance into the program, you really want to make sure that you set up this Complio account right away. What this means is that within the Complio account, you will upload all of your immunizations, and these immunizations are not only important for the program, but definitely for clinical clearance. And that's the biggest thing when we are going to these clinical sites. They want to see that you have all of these immunizations. Biggest ones being hepatitis B, which is a 3 series. So if you do not have that as of yet, it needs to be started right away because it can take up to 6 months in order for that full 3 series to process. Also with the COVID-19, we don't know which sites are requiring, and it's, it's changing all the time. So it's important that you have that as well. But just making sure by July 1 that we have all of this information uploaded, just as Kaylin said, because that date is solid to make sure that our students have time to admit into the program. Talking about the CPR certification, just as Kaylin said earlier, it's really important to make sure you have the correct one. Making sure that the course that you enroll, either with Davidson-Davie on that or some sort of proprietary entity is through the American Heart Association for healthcare providers. There are lots of options out there, but it really has to state those exact words. So please make sure when uploading that to Complio that you have the right one, because if not, they will reject it and then you'll have to take another course. So when scheduling that, please make sure you say those exact words. With all of these immunizations, titers are accepted. So if you do not have your record for whatever reason, you are able to get a titer, which is a blood draw, and they can find out if you have immunization to these minus COVID-19. That would be the only one where we would require a vaccine.
Awesome. And that leads you right into the program in detail. So thanks, Meredith.
Yeah, so, well, thank you for having me here today. I'm excited to talk about the program. Of course, I'm partial to dental assisting because it is near and dear to my heart. I've been in dentistry since 2005 and in education since 2011. So I've been around North Carolina for about 7 years now and absolutely love the community college system here. And I look forward to helping any student who's interested in dental assisting fulfill their goals of this career path. So this is my contact information. Should you have any questions, it is in caps, but it does not have to be when emailing me. Just Meredith_Parker@Davidson-Davie. We do have another instructor who is on staff with us as well, and her name is Nicole Magnuson. So you can reach out to her as well. Both of us will answer any questions we have regarding the program. So a little bit about us. We are an accredited dental assisting program, and I stress this a lot. That's why it's underlined and bolded, because you should know the difference between an accredited program and a non-accredited program. So in the state of North Carolina, an accredited program means upon graduation, you are considered a DA2. This means you are allowed to complete all expanded functions within the State Dental Practice Act. So it's very important to understand the difference between, again, accredited programs and non-accredited programs. We do graduate students as DA2s. Any student that graduates from a non-accredited program would be considered DA1, and their functions are limited. Yeah, that's all on that one. So also upon graduation, you are able to sit for the national certification exam, which is the DANB, which is also short for the Dental Assisting National Board. After passing the Dental Assisting National Board, you will be considered what is a certified dental assistant. And with that, it comes with those little initials behind your name, which is kind of a big deal. So also graduating from an accredited program, it's a little easier to have some reciprocity between states. So if you were to move to another state, it just depends on which one. Graduating from an accredited program, there are options for you to go into other states and work. So that's good. Also, at the end, you will be awarded a diploma upon completion of the program. So where are our classes held? They are held on our Thomasville campus only. Our program is more of an afternoon evening program, which is nice. So if you work during the day or you have children at home, most of our classes start around 3 p.m. and go anywhere between 7 to 8 p.m. We do have classes multiple times a week. So you're in class anywhere from 2 to 4 days a week in the evening. That's important to know that in the springtime, our program starts every August. We have one cohort a year. But in the springtime, starting in March through July, you will be in local dental offices during the daytime hours. So those evening hours flip to daytime hours because that's when dental offices are open. So all of our classes have an online component. So we use Moodle, and a lot of your lectures and assignments are uploaded into Moodle, and you can access those at any time. The program is 12 months. So like I said, we'll start in the fall in August, and students will complete the program early to mid-July. We currently take 12 students every fall. We're hoping to expand on this, but currently it is still 12. We do have the early acceptance that Caitlin went over with the admissions portion, and the tuition and registration is required prior to the first day of the semester. And uniforms must be ordered, and we have in July, and they roughly run, depending on the certain uniforms you select, anywhere between that $350 to $400. They are not currently available in the bookstore, so they are used through an outside entity. So about our program, so dental assisting, as you can see here from those photos, we definitely take x-rays. We work in patients' mouths on a daily basis. We take impressions, offer patient care. And if Kate, let me go to the next one. So the biggest thing is that we work on each other as patients, and we also practice on mannequins. So we first start off on the mannequin component, and then we switch to the patient component. It is important to understand that as a student, you can also be and may be required to be a patient. I think that's important for students to understand that that you're not only going to work on mannequins, but that you may also be worked on as a patient. So here's a general idea of the schedule. And it really just depends, again, on the classes that you have and that you're selected for, because we do have different sections. But it's anywhere from, like I said, 3 p.m. to about 7 or 8 p.m. And same thing with the spring. Now in the spring, it's a little, the first 8 weeks, it's a little later, only because we are down at what's called the East Carolina Dental School using their facility, which we can get into at 5:30 p.m. After that, spring and summer clinical schedule, like I said, it goes to that daytime schedule where you're in a dental office from 7:45 a.m. to 5 p.m. So what are students saying about our program? So it's a fast-paced program. It is only 1 year. And I know a lot of students are like, well, it's only 1 year. Exactly, it's only 1 year. So we're cramming everything into 1 year to make sure that we can get you career ready in this field. So some of the things our former students have said is that the biggest challenge was finding time to balance work, home, and making sure that you're going to clinic and turning in all of your assignments, making sure that you're organized and not to miss class or those assignments, but that they are well prepared going out. So this is just the exact laws here in North Carolina talking about that DA1, DA2 status. Please note that we are an accredited program again, and you would be considered that DA2 upon graduation versus going to a non-accredited. Again, you'd be considered a DA1. So dress policy here in the dental assisting program, due to safety issues with the type of equipment that we use, we do not allow any dangling earrings, visible piercings as far as, you know, in the face. And then also for clinical rotations, we do require natural hair color and style. Tattoos also should be covered while in uniform. If they are not able to be covered, we will require some type of covering, either tattoo makeup or bandages, sleeves, something along those lines to cover them. Drug testing, that goes back to the Complio, the background check. We do require drug testing prior to entering into the program, and then randomly throughout the program if needed. As far as the background check, I just want to state that as a program, we do not deny entrance into the program. However, we do, if there is a positive background check for any reason, it would be up to the clinical site to review those for admission into their clinic. So traits of a good dental assistant, very good with detail, team player, but also being able to work independently. The biggest thing here is going to be attendance and on time, and that goes for classes as well. It's very difficult once you miss courses or any of the coursework to catch up because we are such a fast-paced program. You're going to have to work under pressure, reading comprehension, people skills. We are working with patients, so having that ability to make people feel comfortable. Hand-eye coordination, because we are a hands-on skill set, making sure that you have that ability to thrive in that setting. And then of course, anticipation and perception. So let's take a look at it as a career. So you work with the dentist primarily all day. If you have been into the dental office, you see the individual who sits with the dentist, that is the dental assistant. The individual who is off cleaning teeth, kind of working a little more independently, that is a dental hygienist. And we do not currently offer that program here at the college. However, that's why we require that 10 hours of shadowing so that you can see the difference between the two and appropriately select the career that's best for you. We expose and process radiographs, which are x-rays. We take impressions and make temporary crowns. We work with a lot of different dental materials. We can coronal polish, which is cleaning of the teeth, although that is not our primary duty, and then disinfect rooms and instruments. So going back to the difference between dental assisting and dental hygiene, dental assisting is a 1-year program, dental hygiene is 2. The difference is more of a operatory versus a preventative. Dental hygiene works more on the preventative side, preventing disease by cleaning the teeth, versus we are more of the fixers in the office, and we do a lot of the restorative work. So if someone has a filling, if someone needs an extraction or a tooth removed, if someone is having orthodontic or braces, those are all dental assistants. So if it needs to be fixed, that's more of the dental assistant side. If we're trying to prevent the disease, that's more of the dental hygiene side. So we are in healthcare, and there are hazards, just as there are with many healthcare jobs. We will, and you will be exposed to bloodborne pathogens. This could include HIV and AIDS, hepatitis B and hepatitis C. And that is why we require that Hep B vaccination and starting that right away. We work around a lot of different chemicals. So it's important to know that these are types of things that you will see in the office. If you have a latex allergy, it is a little more difficult, not to say you are not able to find a latex-free office, but please note that that is something that you will find a lot of in a dental office are latex gloves and latex equipment. So where could you work? The majority of our students go out and work in private dental offices. However, there are some hospital-based clinics. We also have some prisons and also public healthcare areas such as county clinics and things like that. So the salary varies, honestly, and with COVID, we've actually seen a large increase in starting salary. But an average starting salary around this area is anywhere between 17 to 19 an hour, but again, varies on the benefits that they offer. You could be offered medical health insurance, and so that your salary may be reduced a little bit based on that. But again, city to city, office to office, but new grads are anywhere between 17 and 19, but we've seen as high as 22. And again, lower, but based on them working for a county health department, but receiving excellent benefits such as retirement. Many dental offices do not provide health insurance, so that is why those individuals take those county positions. However, they usually are provided full dental benefits. So we do not give injections. However, we do set up the anesthetic needle and remove it and assist the doctor with the injections. So I always like to put this on here because it is something that you will see on a daily basis, multiple times a day. We also work within the mouth, and you may see areas that you may not be comfortable with. We do see blood, we see mucous membranes, we see disease, we see decay. So it's important to understand that this is types of things that you will see on a daily basis. We do a lot of surgery in dental offices. So this is a point where you may see or assist a doctor with removing teeth or grafts. But it's also a very rewarding situation to see a patient on the left in picture A. That's a very painful condition where the gingival tissue has receded. And then we assist the doctor with putting a graft on, and then after you can see that it's no longer exposed and the patient's recovered. So aerosols are a big thing, especially with COVID-19. We know that that is the primary route of transmission. And this happens in the dental office. We're using high-speed hand pieces that throw aerosols across the room. So it's very important that we wear shields and masks to make sure that we protect ourselves and the patients. And that's the end. If anyone has any questions.
Ms. Parker, I just have to say that was tremendous.
Thank you.
Just the little thing as far as the difference between the dental hygienist and the dental assistant, I was not even aware of that. So, I mean, thank you for the clarification. One question I have, as far as someone being on a career pathway in the dental field, after the dental assistant too, kind of what's the next step up if someone wanted to continue on, say get their bachelor's degree or go further up the ladder?
Absolutely. So a lot of people think that dental hygiene would be the next step. If they think that dental assisting is a one-year career, and then dental hygiene is a 2-year, so it would be the next step. But actually they're two totally separate entities. Like I said in the office, one is more of an operatory restorative function and the other one is a preventative. So it's not necessarily the next step as it is just more of a transition in the office. Now, at a lot of your larger group practices, you can go to become a lead dental assistant, where you take care of ordering, managing other dental assistants. And then you can even go on to be the practice manager. That's typically the route I see dental assistants go, is lead. And then from lead, you go to office manager. Now, I do see some dental assistants go back and say, I think hygiene might be the next step that I want to do. I want to help with prevent that disease. And so that's a total shift. While we do work in the mouth together, it's not necessarily that next step. So that's an excellent question.
And I'm not seeing anything on Facebook Live in terms of comments that are being made. So if we don't have any questions, then I think that we can call it an evening, and just really appreciate the information that was shared. Again, if anyone has any questions about the admission process, either myself or Sean Thompson would be happy to assist you. And we can both be reached at the Programs with Special Criteria email, which is pwsc@davidson-davie.edu. That's also plastered in that packet in so many different places. And then you can also give us a call on the direct special criteria line, which is 336-249-8186, extension 6771. And I know that Meredith Parker, any questions about the program specifically, would be happy to address any of those questions. Her email is also listed in our packet. So again, thank you all so much for tuning in, and we will be sure to share this recording out to those folks that unfortunately missed this session this evening, but really appreciate your time this evening, Meredith, and look forward to seeing some more applicants come through the dental assisting process.
Thank you, Keelan.